Well, so far, I think the vaccination program has been going quite well. Of recent, we saw more people coming out to get their vaccine. So on average, for the last 3 or 4 days, we've been doing about 4,500 vaccines per day, which has been a big increase because when we started out, we were doing probably about 2,000, then it went up to about 3,000. So now doing at least 4,500 a day is a big improvement. And we think that is going to increase as well. So as of yesterday, we had completed vaccinated 52,554 persons. So, we are on target with what we've set out. And I think that's good that people are coming out to get their vaccines. As you know, most of the vaccines that we're using, they're 2 doses. So those persons who have taken the Sinopharm vaccine, many of them now are becoming due. And as of yesterday, we probably would have immunized about 60 persons who had received their first dose Sinopharm. Now they're getting their second dose. So about 60 persons now have received their second dose of the Sinopharm. They'll have to wait maybe another 7 days after receiving the second dose to be considered to be fully immunized. So all those who took the Sinopharm vaccine, within 28 days, they'll be able to get their second dose. And those who took the Astrazenca, we're asking them to wait at least for 12 weeks. Those who are now taking the Sputnik vaccines, they would have to wait for 28 days, and then they'll get their second dose.
Thank you very much.
We have started to utilize the Sputnik vaccines. However, the rollout of these vaccines, we had to retrain our staff because these vaccines have to be kept at a special temperature. We have to maintain what you might consider to be a very cold temperature, -18 to -20. And once we thaw those vaccines out, you can't go and put them back into the fridge. So because of that, we had to retrain our staff how to use these vaccines. And we have now rolled that out to as many sites as possible. We have, I would say for this week, learning how to use the vaccine, we have completed maybe about 2,000 or between 2,000 to 2,500 doses of those vaccines. So the benefits of these vaccines versus whatever risk that might pose is very minimal. And most of the agencies, talking about the Astrazeneca specifically, most of the agencies in Europe, the WHO, have all pointed to this, that the benefits outweigh the risk. So these vaccines are all safe, and therefore people should have no fear whatsoever in taking these vaccines because they're going to protect you. They would not prevent maybe the infection from occurring, but if you do get the infection, you are not going to get the most severe form of the disease, and therefore it would protect you in that sense. So I want people to understand that, and that alone should be the motivation why you should go and get the vaccine.